Our next speaker is Dr. Anil Nanda. He was chairman of the LSU Neurosurgery Department at the age of 31. Let's let that sink in for a second. Since then, he has continued in that role. He is now the director of the board that certifies neurosurgeons. In 2012, he went out and obtained an MPH from Harvard, and his passion now is preventing football injuries and CTFE in NFL players. So without further ado, Dr. Nanda.
If you like the taste of chocolate, once you've tasted a Sai Laddu, your life is never the same. So thank you again for this opportunity, and I want to thank Dr. Reddy and Venkat and all of you that put on a great show here. You know, at the end of the day, we're all family, and I think it's wonderful to be with family. It reinforces the mission, it heightens our devotional intensity, and it makes us better people. So it's very uplifting. And I picked sort of a strange topic to talk about, because I thought I'll talk about toxic doubtlessness versus uncertainty, because toxic doubtlessness connotates a certain hubris when we take care of our patients. And I think no talk would be complete without obeisance to a wonderful medical mission. I think Sai Healthcare is inspirational. And I think in the immortal words of the master, love all, serve all. I don't think you can add anything more to that. So Harvey Cushing was the great endocrinologist, you'd like that, neurosurgeon, anesthesiologist. He discovered multiple fields. But his great line in Consecratio Medici is that there is only one thing that can effectively define people or bind people, and that is a common devotion. And all of us are here today because we do have a common devotion. We have a devotion to ideal healthcare, to compassion, to kindness, to universal access, and to care for all. So this talk really stems from an editorial in New England Journal of Medicine that they talked about medical uncertainty. And John Keats, who went to medical school, was an amazing poet, and he says, "At once it struck me that quality went to form a man of achievement. But a man, I guess, and woman, to be politically correct, is capable of being in uncertainties, mysteries, doubts, without any irritable reaching after fact and reason." And that's sort of this concept of equanimity. And it goes back to Apollo. Apollo was the god of medicine and poetry. And if you look at the poetic traditions in medicine, you know, Oliver Wendell Holmes, John Keats, William Carlos Williams were all physicians that wrote exquisite poetry that we all get inspired by. And if you look at the physics, I mean, I put this in specifically for Venkat because people don't realize he had a PhD in theoretical physics. But the Heisenberg principle of uncertainty was that you don't know the mass and velocity of a particle. And that sort of questioned the hard facts of physics and science, that there is a mysterious element to all this, and that's something we should always talk about. All science starts really from doubting Thomas. So if you look at when the resurrection of Jesus happens, Thomas is not content to believe. There is an element of uncertainty, and he says, A, I want to see the wound, and B, I want to touch the wound. Only then is he convinced. And if you think of all science, it starts from that. You want observation and you want confirmation. So he touches the wound, he figures it out, this is what's going on. And I think this mythology carries in many traditions. I always feel that my Ishtadevta, Lord Shiva, was really the first neurosurgeon, because when he does a brain transplant on Lord Ganesha, that is neurosurgery starting off. And if I was just in Botswana and you see these beautiful elephants, 100,000 elephants in Chobe, and you're like, oh my God, this is Ganesh all over the place. But I know there's cardiologists in this audience, and I know Dr. Desai is there, and in deference to the cardiologists, the Egyptians felt that the brain was no good. When they mummified the people who were mummified, they didn't worry about the brain. They put a suction into the nose, suction all the brain off, it wasn't important. The heart was important, and the spinal cord. So a deferring mythological statement there. But really, the guy who really talks a lot about uncertainty is Osler. And I will come back to Osler a lot. He's really the father of medicine. His great talk on equanimity and the way you handle things. And he said medical education is, to a large extent, is education for uncertainty. And I think what I'd like to leave you with is a sense of openness, that we do need doubtlessness. We need to make a diagnosis. We need to cure disease. But at the same time, there's something fundamentally mysterious. Sometimes you should be open to that. You should not be rigid to that at all. So let's look at the history of medicine and how these traditions came. Bloodletting for hundreds of years was the standard care of taking care of people. So you opened up their veins, you drained them, and everybody had an element of toxic doubtlessness. They said, this is the best thing for you. From 2,500 years ago, you look at Greek vases, they had this. You look at 1517, taking care of wound medicine. William Harvey believed in it. Vesalius, John Hughes Bennett, and they were casualties of this method. So if you look at what happened to George Washington, he had a little pneumonia. He might have survived that pneumonia, but they put him up and they drained him, and guess what? He's dead. In fact, the first malpractice case in America starts with that because people start whispering against the doctor that took care of him, like you messed it up. Charles II dies that way, same thing, bloodletting blunders. But there's also another side to it. Sometimes our doubtlessness works against medicine. So we know in the journey in 1497 on Cape of Good Hope that they gave citrus fruits to people and prevented scurvy. Okay? It goes 250 years after several trials before they make it mandatory to give you citrus fruits to prevent scurvy. So doubtlessness goes in the other way. We are rigid to adopt innovation. But disruptive innovations in medicine come from so many heroes that questioned everything. They had uncertainty in their mind. Ambrose Paré was the barber, the great surgeon. In those times, if you had a wound on the battlefield, they put hot turpentine oil on you. Well, he decided, he ran out of turpentine oil. He was so nervous, he put rose oil on the wound. And lo and behold, people did better. Same thing with Joseph Lister. He comes up with the carbolic acid, anesthesia, makes surgery safer. Florence Nightingale is the diva of public health because she comes up with the charts during the Crimean War and saying, my God, your troops are dying because your hospital is dirty. You know, she questioned this whole thing. Same with Marie Curie, gets 2 Nobel Prizes, starts radiology. And then, of course, our great personal master, Harvey Cushing. But I think Barry Marshall's story is very good. We grew up doing vagotomies. When I was in India, the commonest operation we had, if you lived in the South, everybody got a vagotomy. It's all the masala stuff you're having. In the North, you got the gallbladders because you're eating too much laddus. In the South, you got vagotomies. There were hundreds of vagotomies, hundreds and thousands of vagotomies. Well, Marshall and Warren say, maybe there's something else. And people laughed at them. So he injected heliobacteria on himself and gets a peptic ulcer. They get the Nobel Prize for that. Again, uncertainty led to a disruptive innovation in medicine and changed the way we thought. But we've had disadvantages. You look at lobotomies. In the 50s and 40s and 50s in the United States, the commonest operation. Freeman Watts would go into psychiatric institutions, do 15 lobotomies, and there was a gender bias. They would do it more on women. They would do a bunch of lobotomies on them and say, oh, we got to get cured. Never worked, was a disaster, and we weren't doing the right thing. So I want to talk a little bit about my personal experience. We sometimes get very comfortable with what we do. I've done 17,000 surgeries. I've done like 6,000 craniotomies. I think, toxic doubtlessness. I know what I'm talking about, okay? So, I've done over 1,000 aneurysms. This is what I sort of specialize in. It's a little niche these days. Medicine is so specific. You're taking care of ingrown toenails, and you're the world expert on that. And I take care of skull-based tumors. This is something that I write a lot about. And I always like fields where there's intellectual cross-pollination. And so we are here today looking for ideal science healthcare, and all of us bring something to the table. And what we leave with is not only a common devotion, but an intellectual cross-pollination. So you look at this, and this is how our field started. We published a bunch of this. So there's a little hubris here. I know this, I've done this very well. And I think this is when, for the younger people in the audience, that you really need to be able to do an autosympathectomy on yourself. That you have to have Oslerian equanimity, because if you lose it, you're going to lose the patient. And I think that equanimity for Sai healthcare, for compassion, is extremely important, that you have that. So we're very blessed, she does well. But, I think I call these moments memento mori. When you look at medieval popes, and even Queen Elizabeth I, she would wear a watch with a skull on it. Every time she would look at the watch, she would see a skull. It's like, remind you of your death. When the popes in the medieval times were inaugurated, there'd be a guy at the back whispering, "Sic transit gloria mundi," life is brief, okay? And I love poetry, and I think this is a wonderful poem by Agamemnon that I read with my residents when we have a complication. And it says, "God whose law it is that he who learns must suffer. And even in our sleep, pain that cannot forget falls drop by drop upon the heart. And in our own despite against our will comes wisdom to us by the awful grace of God." This is one of the great poems. When Martin Luther King was assassinated and Robert Kennedy was in the city of Los Angeles, they told him, "We need to get you out of this neighborhood, no speech, you're out." And he says, "No, I'm going to give a talk." They're like, "Okay, we'll write the talk." He says, "No, you're not writing the talk." And he says, this was the poem. He talked about his brother's death that he had never talked about privately or publicly. And when Martin Luther King dies, he recites this poem and says, "This is what got me through what I went through." And I think it's a wonderful piece. And there's a whole thing on second victims, that people who have this, that we do get second, and as physicians, we do not handle complications that well. And we take it very lightly, like, "I'm tough, I can handle it." And I would urge you that, whether it be meditation, whether it's go to satsang, it's important to go through, because we all get this. The person that tells you, "I've had no complications and have perfect results," they're not being honest about this. And I think you really need that humanism to have that. Now, I'd like to say these complications are just not our monopoly. This is in the New York Times 2 years ago. Patients in Chicago with trigeminal neuralgia, a benign condition, needed radiosurgery. They got a little shot to the trigeminal nerve, minor mistake. They gave 10 times the dosage of radiation. All 6 patients were dead in 6 months. Their brain stems were cooked. So this toxic doubtlessness goes to every field, and we need to be eternally vigilant about it. So what comes at the intersection of toxic doubtlessness and uncertainty? And I think it's faith and compassion. I think faith, I'm a believer, I would never want to proselytize anybody, but I think that's an important thing, and there's a history of faith in our field. If you look at the Roman Emperor Claudius, the first time the word profession is used, Scribonius is his physician, and he says, "A profession is a commitment to compassion or clemency in the relief of suffering." This could be an identical quote from Sai Healthcare, that we want to have this commitment because that is so important. And if you look at any faith, if you look at Krishna when he does a spine operation on the one with kyphosis, or you look at the Western Wall, anybody goes to the Western Wall, it's beautiful. You put a little shit in there, you stick it in, and it's just so soulfully reverberating that it keeps us going. And then if you look at the real Christian tradition of healthcare, you look at the Catholic hospital in the United States, this goes to Francis of Assisi, the Benedictine monks, strong history of faith in healthcare. And I think compassion, the Greeks have a wonderful word. There are many forms of love, eros, but agape is the best. Agape is unconditional love. And I think in healthcare, we are really blessed with agape. Ambrose Paré said, "Je le pensais, Dieu le guérit." I did the dressing, God did the healing. And James Keenan was a Boston theologian, and I love this definition of mercy. And he says, it's entering into the chaos of another. Every day we as healthcare professionals enter into the chaos of others. Our goal is to do it with compassion, to do it with kindness, to do it with a sense of seva. And this is present in art. If you like art, you look at this. This is Goya's self-portrait when he was really sick with cardiac instances. And again, Dr. Desai, I always bring the heart in. So he had a heart attack, and his person took, and he's a wonderful portrait of him taking care. This is Luke Feldis's portrait of a child dying. Luke Feldis's own daughter died. And he was so indebted to the physician that he painted this for them. Issa was the great haiku master from Japan. And he had this wonderful haiku poem, "This world of dew is a world of dew, and yet, and yet." It's like this is a world of Maya, and yet it bursts. He went through some great personal tragedies. His father died of typhoid, his kids died. But again, that compassion. And I think if you look at the art of medicine, I think the value of medical uncertainty, this is the plan, hoping for plan C. No plan A, plan B. And I think maybe in between toxic doubtlessness and uncertainty, there's the middle path that we search for and hope to do that. I'll diverse a little bit into public health now. So you look at this is John Snow in London, the strict vegetarian, and at that time cholera was thought to be miasma. It's in the air, it's in the air. But he took that doubtlessness away. He looked at all the water pumps in London, and he figured out cholera was coming from the water supply. So again, an innovative thinker. And our debt to Florence, I mean, people just think Florence Nightingale stood with a little candle and took care of the British troops. She is the mother of public health. You look at the pie chart, she told you what's happening with these hospitals, why people are sick, what's going on. And again, a great luminary in that field. But we as a profession need to look at ourselves critically. Toxic doubtlessness was shattered. When the Institute of Medicine report came out, there's 100,000 people dying every year because of medical mistakes. Just to give you perspective, that's like 4 747s crashing every week in the United States. Every week. That's huge. And we take responsibility. Wrong medications, wrong side surgery, these things happen. So, oh, it's not going to happen to us. So this is an example in Tenerife where a KLM flight was about to take off. Okay, this is on the land, all right? He has co-pilots, they're ready to take off. And they say, okay, you know, we want to check with the control tower. He says, no, he doesn't check. The pilots say, well, we should keep quiet. The 747 crashes on the land with a TWA flight. 573 people died there. Again, I think from an Indian cultural background, we believe in the hierarchy of power sometimes too much. You know, if you're the big professor and the nurse comes in and says, you're operating on the wrong side, you should listen to that. You shouldn't just think, oh my God, I'm too big. How could you question me? I remember I was a young attending. I was taking a tumor out, and the intern comes up to me and says, Dr. Nanda, you know, this tumor's on the right side in the brain stem. I'm like, how are you going to get this from the left side? I'd made the incision. I'm like, okay, close it up, talk to the family, switch it around, got it done. This happens to us, and we have to be extremely careful. The safety in the aviation industry did a beautiful job on this. You can see the number of crashes have gone down. You don't think twice before going on a plane ride. Now, your chances of getting injured in a car accident are much more than when you fly. And that's because the pilots have been very good about that. And this is what the press does. I mean, you look at this is toxic doubtlessness. This is from the Wall Street Journal. They say every hospital in America has a Dr. Hodad. Like, who's Dr. Hodad? It's hands of death and destruction. I hate to tell you this happens everywhere, and we as a guild protect each other too much. We don't say, oh my God, maybe we need to report this, maybe this is not right. And I think the Swiss cheese model is so true, it goes right through. I show this slide to my residents frequently, that you make mistakes. You're like, if you don't have filters to prevent this, it's not gonna get better. And this is the Mass General, very world-reputed orthopedic surgeon, does a mea culpa editorial in the New England Journal of Medicine where he operated on the wrong hand. How does that happen? In the world's best hospital by every survey, US World News Report, whatever, you're operating on the wrong side. So this stuff happens, you have to be vigilant about it, and this comes from toxic doubtlessness, like hubris. How could I make a mistake? I'm not moral. And I think that's what we need to be really good. These are the 10 shocking medical mistakes. You look wrong side surgery. And this is a kid in New York that was, he had an oxygen canister with him, went straight right through his head, and he died on the spot. So these are errors that happen that we have to be eternally vigilant in and again, you know, generals talk about making decisions in the fog of war, and we practice medicine in the fog of war, fog of medicine. Sometimes there's no clear-cut answers. Most times we know what we're doing. Sometimes we don't. But that openness is extremely important. And I think public health-wise, you know, they talk very well about diabetes, Dr. Mohan did yesterday. Look at obesity. Obesity is a huge problem. And you talk about cognitive dissonance. We had a brilliant lecture on diabetes yesterday. What did we all eat when we went out there? Who's not guilty of eating a cookie? We got to address that, right? It's cognitive dissonance. Like, oh my God, where did we miss? This is obesity in 1985, United States. 1995, and then the chart, there's new colors coming up because the BMI is going over 30. You know, so this is a big problem, and I think, you know, no matter what your specialty is, you have to have a devotion to it. I will not operate on patients that smoke for spinal fusion. I refuse to do it. I said, unless you show me the determination that you're going to quit smoking, I'm not doing a $100,000 operation on you. I just think it's morally reckless. I'm like, no, we're going to check your nicotine level. You can't quit. You got to show, you know, you have to show commitment. And same thing with obesity. Here it is, huge things, and this is a global problem. And I think the mismatch is where Sai healthcare comes in a lot. This is Mexico has now overtaken the United States as the most obese country. And this is David's Michelangelo in today's case would be a little different. And this just shows you the chart of physicians working. You can see sub-Saharan Africa, we don't have enough physicians there. Maybe and this is wonderful outreach programs you guys have talked about. And then you look at stroke deaths. I mean, India and China, huge stroke deaths. Again, diabetes. Again, this is where we need to create awareness. And again, costing. You want to make free. This, in the United States, geography is destiny, okay? If you go to Florida with your back, you're 4 times more likely to get an operation than if you're in New York. Just the way it is. Even in McAllen, Texas, you get a cardiac cath, you'll get a scope done, you'll get all this done. So there's these immense vagaries on this, and it's not based on hard science. And I think this is Porter's work on quality and service. This is very important, that we give ideal health care that means good quality, good service, but it has to cost less. We can't just say everybody gets a Cadillac. You know, maybe you all need to take the bus. The bus might get all of us safely there. And I think in our own specialty, spine has had an explosion. We now spend in the United States over $90 billion on spine health care, more than cancer, okay? So you would think you spend all this money, your outcomes are much better. Everybody is like doing yoga at 90, they're looking great. No difference in outcomes. So we're spending all this money and we're not getting a good result on that. And then sometimes we can overkill. So in South Korea, they had this whole program to diagnose thyroid cancer. Everybody got an ultrasound, okay? 15-fold increase in thyroid cancer surgery in South Korea. You would say, great, this happened. Now our mortality from thyroid cancer will go down. Guess what? There's no difference. So we were doing all these unnecessary operations on them. This was affluenza all over again. We're going to give you a test. We're going to do all this stuff. But by the way, you probably don't need it. So that's not good either. My own area that I'm very interested in, concussions. You know, perhaps in this audience, sports is not that important. India doesn't do too well in the Olympics when it comes to athletics. Every Indian kid goes to the spelling bee. He ain't going to football camp, okay? It's just the way it is, guys. It's a cultural thing. Just get used to it. So so this is just, we talk about, can you play this here? So here, this is just to show you some of the videos. These are the kind of concussions we see. You know, I feel bad with this McGregor fight. You know, it's like massive concussions. These people have bad issues. We've seen some of the NFL players, and these are bad, bad injuries, yeah. And you can there's somebody going to Grand Mall at the rugby match right there. And here's another one. Look at the head-on collision right there. So again, we need to create, and this has become important for PTSD. The troops coming back from Iraq, you know, used to say, oh, there's nothing wrong with you, get back to work. You know, this was doubtlessness in the 70s after the Vietnam War. We didn't recognize PTSD, like doesn't exist. Your CAT scan's normal, you just don't want to work. So I think that, again, is important. And I think we should also look at this from a governmental and political activism point of view. So I always call nonviolence, you think, you know, sort of a Gandhi thing. It really starts in the United States. I call this the American boomerang, because Thoreau first talks about civil disobedience. It's taken up by Tolstoy. Tolstoy loves that, and then Gandhi gets very influenced. I was just in South Africa, and I visited where Gandhi was, and he named his farm the Tolstoy Farm. And if you look at that, that influenced Martin Luther King. And so he does this whole injustice anywhere is injustice everywhere. And I think it's so poignant today that, you know, all this influenced Madiba. Nelson Mandela, if you ever have one thing to do, you should visit Robben Island. Here's a man who spent 27 years in one cell because he believed in a cause. It's very poignant to see that. And I thought this was so powerful right after the Charlottesville incident. President Obama's tweet is the most tweeted tweet in history, 2.5 million retweets. And all he does, he doesn't say anything, he just quotes Mandela. He says, no one is born hating another person because of the color of his skin or his background or his religion. People must learn to hate, and if they can learn to hate, they can be taught to love. For love comes more naturally to the human heart than its opposite. And I think this is wonderful, it's great, but you got to remember, sometimes love doesn't work either. And you know, one of the great things about Gandhi was he actually wrote to Hitler and said, you know, 19th dear, I would like you to desist this, you know, you should be nonviolent. Some of these people don't listen. Hitler's solution to the Indian problem was you kill Gandhi and then you kill the next 100 Gandhis that come up. So sometimes our puritanism doesn't work. And I think our political activism is important. You know, if you look at the Burton institution, the Hill-Burton Act built $5 billion worth of hospitals in the United States. And especially if you're from the South, they were segregated hospitals. It's just the way it was. They're like, okay, we're getting federal money. Well, after the civil rights movement, They come in and they say, you do not get aid if you have a segregated hospital. Overnight, hospitals get desegregated. So what impact does that have on healthcare? Well, it's clear cut. If you look at the number of births, African-American births in hospitals, after 1965, it catches up in about 5 years. The other thing is, you look at postnatal infant mortality deaths due to diarrhea and pneumonia drops precipitously. So government intervention does make a difference, and we know this from historical facts here. That's why this is important, and we should be, involved with that. So to sort of time it all up, I think we have to do no harm. I think we must be honest. These are Rembrandt's self-portraits. If you look at him, he paints himself with such honesty. It's not like he puts a facelift of himself. I put a little Botox on myself. I'll look cool. No. This is how we as physicians need to look at ourselves. Just be honest. What are we doing? So toxic doubtlessness is from Mars. Uncertainty is from Venus. And half of what we teach you is wrong. I always tell med students, we just don't know which half. We hope to get you right, but I think we have to be honest to know that. And so I will leave you with equanimitas, the great concept in the 1890 graduation address that Osler said. Osler was an amazing man. So he went as Regis Professor at Oxford, and 40 years later, some woman comes up to him, weren't you a professor at Toronto? He said, yes. He says, 40 years ago, my brother died there. You took care of him. And he said, no parent should go through that, but you took the time. He was in Toronto. He sent a letter to England to his parents and said, your son died a noble death. I read him from his favorite scriptures, and he died peacefully. No parent should go through the death of their child, but this letter meant the world to him. And I think that is the concept of compassion that matters. And I think Francis Collin put it best. He was in Africa, and he meets this patient with pericardial effusion, and he doesn't know what to do, and he puts a needle in, and the guy's like disconsolate. And the guy looks at him, he says, you have some doubts why you came here? He said, yeah. He said, you came here for one reason. You came here to help me. And I think that's what we all linked up for. We're here for a reason. And I would end, as always, that, for me, and I address this to the younger people, the greatest privilege of my life was to be impacted by Bhagwan. It was in my chromosomes. Nothing I have ever done would ever give credit to how much he gave to me. And I would take me several lives to give back. And so I was incredibly blessed. And I think we all need to have that. We need to have that common devotion, that common calling, that it's a great privilege to practice this great art. And we are so blessed to do it. Sairam, thank you.